So as women age, they may become more prone to conditions like recurrent urinary tract infections, urinary incontinence, overactive bladder, and conditions associated with leakage of urine with overactive bladder, as well as pelvic organ prolapse. So urinary tract infection is an infection of the urinary tract that can really involve any part of the urinary tract. That includes the kidneys, the bladder, or the urethra. And is mostly caused by a bacteria. And the most common bacteria that causes urinary tract infection is E. coli. Most commonly when someone refers to a urinary tract infection, they're referring to an infection of the bladder. Common symptoms of a urinary tract infection can include burning with urination, foul smelling or cloudy urine, going to the bathroom frequently or needing to rush to the bathroom, or sometimes in cases even fevers and chills. Well, the standard treatment for urinary tract infection is an antibiotic. But it's important, I advise patients when they have symptoms of urinary tract infection to try to obtain a urine culture prior to starting antibiotic therapy, because it's important to figure out whether these symptoms are actually caused by an infection or something else. Well, there are a number of things we recommend to patients to reduce their risk of urinary tract infections, and that includes maintaining adequate fluid intake, that's drinking enough water, as well as maintaining proper hygiene. Another recommendation I have for particular younger women that often get urinary tract infections after intercourse is voiding after intercourse, and sometimes this can help prevent urinary tract infections. Frequent question I get from patients is, does cranberry juice or cranberry supplements reduce the risk of urinary tract infections? So there's been many studies done on this, although nothing absolutely conclusive. There is enough evidence to suggest that cranberry supplements does reduce the risk of urinary tract infections. However, many of the studies that have been done with cranberry juice have been less positive. So oftentimes I do recommend to my patients to start on a cranberry supplement with a standardized dosage of the ingredient that does reduce the risk of urinary tract infections. It's proanthocyanidin, or PAC is the abbreviation for it, and many of the studies that have been positive in reducing the risk of infections have had a standard dosage of this. So pelvic organ prolapse is I would like to describe as a hernia into the vagina of the surrounding organs. And this could be the uterus or the bladder on top of the vagina, or as well as bowel like the small intestines or the rectum that could be herniating into the vagina. Common symptoms of pelvic organ prolapse are feeling a bulge or heaviness in the vaginal area. There could be some discomfort in that area. There could be discomfort during sexual intercourse, or sometimes you may even notice a bulge or something coming out of the vagina. If you notice any of these symptoms, I would recommend the patient seek additional evaluation from their physician. There are many treatments for pelvic organ prolapse. Mild forms or asymptomatic pelvic organ prolapse may not require any treatment at all. Other times they can be improved simply with pelvic floor exercises, as well as pelvic floor physical therapy. More severe forms of prolapse, particularly symptomatic prolapse, can sometimes be managed with surgical treatment. Here in Baptist Health, we offer surgical treatment that uses both the patient's own tissues as well as using synthetic material. Another good treatment for pelvic organ prolapse is a vaginal pessary, and this is a rubber insert that's placed into the vagina and help provide the additional support. And this could be a good option for patients either who are not good surgical candidates or who do not wish to undergo surgery.